Yeah, world health leaders named the Omicron variant a variant of concern just 17 days after it was discovered. Now, that's by far the fastest they've done this. You can see the Delta variant here wasn't named a concern until 7 months after it was discovered. Now, leaders say it's the number of mutations on Omicron that suggest it could spread very fast.
When given opportunity and time, viruses are going to mutate. That's what they do to survive.
South Carolina's public health director says COVID-19's most recent mutation, the Omicron variant, is quickly becoming a global concern.
There is some evidence out of South Africa so far that, at least in the one province, that it did relatively quickly outcompete the Delta variant.
Now, we know how quickly the Delta variant spread throughout the U.S., so the possibility that Omicron could spread even faster has South Carolina on alert.
If it is not here, it could very quickly and easily come here. And so that is why it is important for everybody to do these protective mechanisms.
Dr. Trexler says part of that is to ramp up testing. When you get a nose swab test that's positive for COVID-19, the Omicron variant has what's called an S gene dropout. Now, it's rare, but other variants have that same marker, so to be absolutely sure, scientists need to do a full sequence test.
We are sequencing essentially almost all of our positive results, all of them that meet the criteria.
The doctor on the White House's COVID-19 response team tells me that's nationwide right now.
It's never practical to sequence every single test that's administered, but I think it is really important that we're doing it at a high level all over the country, high enough to be able to tell when we're seeing more cases of Omicron.
Now, both say it'll be a couple weeks before we know how our vaccines stack up against Omicron or how sick it can make us, but there are things that we know work.
Vaccinations, masks, testing, and physical distancing.
Now, that information that we could expect to see in the next couple of weeks will be lab-based testing. The actual real-life evidence will take even longer. Both doctors say getting fully vaccinated is the best precaution you could take right now.
Jen, while there was no shortage of pride, celebration, and creativity at the second annual Rock the Red Night of Living Art, the Little River medical staff and patients say spending time together to display their support is what really matters. Music, art, and lights filled the Little River Medical Center as patients and staff came together, bringing awareness to HIV and AIDS and its changing stigma. Both a patient and a staff member, Robert Pierce, says he is not dying from HIV.
That old stigma and stereotype has to go because I've been living with HIV since 2002.
And Chris Sampson, another patient and Little Rock staff member, says he was recently diagnosed with HIV.
I've been living with HIV for 3 years. It's kind of still fresh for me, but with the medications and science that's out now, I'm living a regular life.
Both of them say it's important to understand that an HIV or AIDS diagnosis is not a death sentence.
It's a fight for each individual's lives, and I decided to fight for mine, and I'm quite sure Chris has fought for his, and it's an ongoing battle, but it is a battle that can be won with compliance and self-love.
After accepting their diagnoses and getting the help they needed at Little River Medical Center, Pierce and Sampson say it wasn't long after that they were hired on as peer navigators.
Every person that's on staff here in our department knew me as a patient, and I kind of grew with them. And when they offered me a position, I was like, wow, I was blown away.
Peer navigators offer support, advice, and as Pierce says, living proof that anyone can live a happy and healthy life with AIDS or HIV.
We share a lot of similarities with the patients where they open up more freely with us. For example, one of the patients called back and said that we'd rather talk to the peer navigators than any other medical staff.
Now, both Pierce and Sampson say that being peer navigators and getting to work with other patients continues their journey not only to help educate others, but they continue to learn new things themselves.
Yeah, the executive director for the program offering this training says it used to be that someone on the autism spectrum would put a sticker on their car or maybe put the notifying symbol on their driver's license, but those quickly became a target for bullying, and now they're much less common. Now, this sticker on Surfside Police Department's door here means that these officers are trained to know what to do when they find someone who doesn't have the symbol.
When a person's brain and its senses don't communicate well, the brain can become overwhelmed.
Autism is a spectrum, and the Champion Autism Network's executive director, Becky Large, knows how sensory overload can combine with misunderstanding context in many ways. Her son has high-functioning autism.
If they're at a traffic stop and a police officer asks to see their license, and the license is in their wallet, in their back pocket that they're sitting on, the person with autism might say, no, you can't see my license.
Knowing what to look for is a community effort, but Large says it's especially important for police officers.
You can see the cop putting his hand on his gun or the taser, and the person with autism still not picking up on it, and like all of a sudden they're getting pulled out of the car. Like, who knows? We've seen it.
And that's exactly what their training program hopes to avoid. After Surfside Beach Police Department's completion, Chief Kenneth Hoffman says it's bringing benefits to any de-escalating situation.
If officers have those skills to be able to recognize any trait, autism as well, that they can just slow it down a little bit and communicate in the right way.
It also brings officers into someone with autism's world.
This type of training is so important to the good, healthy functioning of a police department and police officers within their community.
Now, Chief Hoffman says they also worked with this program to create the Community Assistance Program, or CAP. Now, that program lets visitors or people who live here fill out a form to list any special needs. So if an officer is responding, they know to turn off their sirens or ask direct, literal questions.
Well, Jen, they have a rough draft of a map. So looking at it behind me, you can see this blue outline right here. That's just over 700 acres of land that they're looking to develop with multi and single family homes. A major concern from residents in many rezonings in Horry County is destroying wetlands and wildlife. This area right back here along those blue lines is an area that developers say they'll leave out of their plans because it does have those wetlands. However, community members say they still don't want homes added. Just under 4,000 homes are in the works as the developer is trying to rezone over 700 acres along Highway 707 near St. James High School. Walter Warren from Thomas & Hutton Engineering Group says there's not a final land plan, but they're creating map layouts and gathering data to expand the Burgess community.
We went through the entire Burgess plan and said, all right, what was the vision here? What did Burgess community want to see happen in Burgess?
Warren says some of those major principles include connecting neighborhoods, adding more linked pedestrian paths, and making final connections to the Burgess Trail system. But Horry County Councilman Joey Ray says he's concerned for how this will affect current residents.
What's all this going to look like in the future? I mean, is this going to be a good, sustainable, beneficial project to the entire community?
And a handful of residents who are unhappy about the development idea stood up to share their concerns.
We need time to understand, see a better proposal. 2 or 3 meetings is not enough time to review, understand, and offer input.
Flooding. All of Horry County is flooding. All of Horry County. We got a problem in this county, and it's not smart for us to continue putting up homes.
Resident Bob Ziegler says just because the community doesn't want it doesn't mean nothing will be done with this land. So he suggested,
we want to continue to interact with the development and with the planning staff to better understand issues like the traffic, stormwater, school, the impact on schools, first responders, things like that.
Now, another concern coming from community members, especially with this rezoning proposal, is how it'll affect school enrollment. Right here behind me, you can see the current functioning percentages and numbers that are allowed at the St. James Intermediate School, Elementary School, and High School. Looking at St. James High School, they're already at 108% capacity. St. James Elementary is at 102%, and St. James Intermediate is nearing that 100% capacity rate.